President of Reading Area Community College. We are honored to have Governor Tom Wolf on the Reading Area Community College campus today to help us reinforce the importance of vaccinations in mitigating the spread of COVID-19. I would also like to thank Senator Judy Schwank, Representative Manny Guzman, Mr. George Fernandez from the Latino Connection, and Kathleen McKenzie from Highmark Blue Shield for being here today to support this important initiative. Berks County has a population of about 420,000 residents, and with the help of Governor Wolf, the CDC, and other local and regional partners, Reading Area Community College is proud to support and host the mobile vaccination site in our efforts to make the vaccine accessible to all. It is now my pleasure to welcome Governor Wolf. Thank you.
So thank you, Susan, for that nice introduction, and thank you for allowing us to be here. And I just want to say, give a shout out to my colleagues, Senator Schwank and Representative Guzman. Thank you for, I was going to say for being here with me, but thank you for having me here with you. Thank you for inviting me.
You around.
Well, yeah, right, okay. And again, to Susan, thank you to the Reading Area Community College for hosting this event and for hosting the vaccine clinic especially. This is really important. The clinic is the result of a partnership between the Berks Community Health Center and the Latino Connection. You're going to hear from George Fernandez, who is the founder, I guess, and now CEO of Latino Connection. And I want to thank everybody who's made this happen. As you know, getting Pennsylvanians vaccinated is our #1 priority. That's the strategy we have for beating COVID. That's the one way we can actually beat this disease. COVID-19 vaccinations, they save lives by keeping everyone around you safer. If you get sick and you had the vaccine, you're not going to get as sick as you might have without the vaccine. And you're much less likely to be hospitalized or die than people who have the vaccine. If you're vaccinated, you have a lower risk of spreading COVID-19 in the community. These are all good things. So as we move toward fall, we have to look ahead and make decisions now that will keep us safer in the weeks and months ahead. Pennsylvania has done a really nice job in the vaccines. I think we're 9th in the country now in terms of one dose. We're actually #1 of the 10 biggest states in the country in terms of the percentage of our population that has had at least one dose. I think as of yesterday, we were 9th in the country in terms of adults who have gotten at least one dose. I think we're in the 80-some% range in that. But as we move toward the fall, we've got to make sure that we're prepared. There is one big gap in the vaccination strategy. Vaccines are our strategy, but as you know, if you're under the age of 12, you can't get the vaccine yet. So we have a problem. The problem is that in K through 12 schools, we need students to be back in the classroom, and they can't be vaccinated. So we want to make sure that they're in school, they get into school, back into the classroom, and that they stay there. And we know that the dangerous, fast-spreading variants of COVID-19 are posing a danger to their health. So what do? That's the obstacle, these variants. And if we don't reduce the risk of COVID somehow in our schools, in our kids, then we increase the risk that they're not going to get back into the classroom. And that is a bad thing for all of us. So we need to do everything in our power to reduce the spread of COVID-19 in our communities. Again, vaccines are the main strategy. But if we can't get vaccines, we need to wear masks indoors, especially in the K through 12 space. And we need to make sure that students who can't be vaccinated yet wear those masks. In college communities too, it also means getting every eligible person vaccinated. That is the primary strategy. Getting vaccinated is how we end this pandemic. It's how each of us can be part of the solution to COVID-19. And it's a way that we can protect people around us who cannot get the vaccine yet, again, including those kids who are under the age of 12. You may not have a personal connection to a child under 12 or someone with severe illness that keeps them from getting vaccinated. But I can guarantee you that someone you know does. Someone you know, one of your friends, one of your neighbors, one of your classmates, one of your coworkers, they actually are around somebody who does need you to be vaccinated. And by getting vaccinated, you're protecting other people's loved ones in addition to your own. You're lightening the burden for parents, for teachers, for nurses, and for doctors, the burdens they carry each and every day. So thank you to every Pennsylvanian who has gotten the vaccine, every Pennsylvanian who has stepped up already to get vaccinated. Thank you for doing your part. And for those Pennsylvanians who are not yet vaccinated, please, please make that appointment today. It's time to get protected, not just for yourself, but for the people around you. Vaccination is easy, it's free, it's safe. And with organizations like the Latino Connection, it's convenient. Clinics like this are available whenever you're ready to take that leap, take that step to stop COVID, get vaccinated. Thank you. And now I'm going to turn it over to George Fernandez, founder and current CEO of the Latino Connection. George.
Buenos dias. For those of you that have asked, I am wearing a Dominican dress shirt. It is called a chacabana, and my Puerto Rican friends call it a guayabera. Thank you for those that asked. Before I recognize the most obvious reason why we're here today, please allow me to tell you why this moment represents something very important to me personally. I'm a product of a single mother of 3, a victim of domestic violence whose family never qualified for social assistance programs. Out of this challenge, it grew my life's passion for ensuring Latino and non-white communities never experience what my family did and always have adequate access to social assistance programs. This passion has fueled the mission of Latino Connection and is the heart of CATE, our COVID-19 mobile unit, which many of you have seen here today. Since the inception of CATE just over 1 year ago, we have quite literally driven COVID-19 resources into the center of our most vulnerable communities, and the progress we have made is nothing short of astounding. It takes no more than a quick reflection on our world 1 year to appreciate what a milestone it is, even to stand here today in the community. Not that long ago, businesses and schools were closed. Individuals were losing their jobs at a staggering pace. There was limited access to basic necessities, and all of us lived in fear. But today and every day forward, people have increasing access to free and safe COVID-19 vaccinations and testing. In just 1 year, CATE, our COVID-19 mobile response unit, has visited over 240 plus locations across Pennsylvania, has served over 20,000 Pennsylvanians, administered over 5,200 COVID-19 tests, and have provided an astounding 8,300 plus COVID-19 vaccines. And with every CATE event, like the one here today in partnership with RAC and Berks County Community Health Center, the health and safety of our communities continues to grow. Deserving of the highest recognition in our community partners who came alongside Latino Connection to make every one of these accomplishments super possible, words are not enough to thank Governor Tom Wolf, the Pennsylvania Department of Health, Highmark Blue Shield, Penn State Health, and many community organizations like Reading Area Community College, Berks County Community Health Center, and who saw the potential to change the world and save lives. Through the power of partnerships, CATE will continue making many more stops across Pennsylvania this fall, and our mission will continue to pivot and meet the greatest needs of our most vulnerable populations. But the fight against COVID-19 is far from over. We must now turn our attention to combating vaccine hesitancy through access and education. The only way we can effectively end this virus is to each do our part, whether that's getting vaccinated or protecting ourselves through masking and testing. I encourage everyone who wants a COVID-19 vaccination to utilize CATE for vaccinations, testing, and education to stay safe, informed, and protected. Thank you for being here today and for being a part of this life-changing initiatives for thousands of Pennsylvanians. I'd now like to turn the podium over to our dear friend and supporter, Kathleen McKenzie with Highmark Blue Shield.
Thank you, George. Good morning, everyone. I'm Kathleen McKenzie. I do social responsibility for Highmark Blue Shield, an insurance company here in Pennsylvania. And it's amazing to me to see all the students behind us who have have taken what I do for a living as social responsibility as their job in life. And I'm just so proud of them for being healthcare workers going forward. I think we need to give a round of applause to all the students who are behind us and choosing a field that's so important in Pennsylvania. Thank you, students. We really appreciate you. We're so excited to be here today at the Community College, and thank you, Dr. Looney, for inviting us all. George Fernandez and Latino Connection, we've been working together for the last 2 years. First, we started out doing the COVID testing, and now it's vaccinations. And George has been one of my best friends, but the biggest champion for the Latino community across Pennsylvania, and making sure that the Latino community not only has education and resources such as masks or other sort of protective equipment, but also getting the vaccines and the testing in their own language. Everyone on the Kate mobile unit, which you'll see over there, speaks Spanish. It's so important because if you have a question and people can't understand you and understand your language, you're never going to get your questions answered. We need to educate, and they're able to educate people in their own language, and it's amazing, and I really appreciate all the staff of the Kate mobile unit. They're very talented community health workers. So as I said, over the past 12 months, we've worked with the mobile unit, providing these essential resources, and we're proud to be the lead sponsor of this initiative. We want to extend our thanks to Governor Tom Wolf, who's championed this program from the very beginning. Dr. Rachel Levine was with us at our very first press conference. Secretary Beam has been with us. Secretary of Agriculture has been with us. And of course, you know, a lot of state senators and representatives along the way, they've stood beside us and said, yes, this is important. So with the governor's leadership, we've had every elected official showing up at these events to make sure that the community understands how important this is. We've hosted 230 events, and as George has said, over 8,000 vaccinations, more than 20,000 people. It's an incredible feat, and over 50 counties in Pennsylvania have seen this van. We're proud of the efforts, and we know that there's still a lot of work to be done, as the governor said, to address vaccine hesitancy, misinformation, and access. We still need a lot of people to get vaccinated, and we're eager to continue collaborating with George, the Department of Health, and many more people to get shots in arms. As I said, we want to thank all the clinicians and the soon-to-be clinicians who have helped dedicate their time and talents, often on a volunteer basis, to get this done. Together, all of us can to make a difference in Pennsylvania by getting this done. I want to also introduce right now Senator Judy Schwenk, who is your senator here in Reading and Berks County, and a good friend of all of us, especially at Highmark. Thank you.
Good morning, everyone. Glad to be here with you today. Kathleen, thank you for giving a shout out to our students that are here today. I'm really proud of you, all of you standing back there. And I would hope, Governor, as you're here, you can see this place is happening. RAC is a happening place in Reading. It just is. You know, beyond the education, the wonderful education that our students are receiving, this is a community hub as well. So it's very, very important that we continue to be supportive of what you're doing. Thank you, Dr. Looney. Your leadership has been fantastic. Thank you, Governor, for being here with us today. Before you came, Governor, we saw somebody getting a vaccine. Yay! So this is working. And to George, you know your way around Berks County by now. You've been everywhere. It's amazing.
I love it here.
I'm glad you do. Thank you. The work that you're doing here to help get people the vaccine when they're ready for it is really, really important. Look, we all know there's so many people that need to be convinced yet that they need to get a vaccine. To a certain extent, I feel like I'm preaching to the choir here, more than likely, that the majority of people here, and I would hope all of you, are vaccinated. But when people do finally get the urge and want to do it, they need an opportunity to get that vaccine quickly, right? Maybe even making an appointment is too much effort or just cannot happen based on people's schedule. So continuing to have clinics like this, Kate, arriving in our community, and other sites that have taken up, you know, the charge through our community health center, who've been able to get vaccines out into our community, at least the possibility of getting one. That's really important. Just-in-time delivery really is going to matter, I believe, at the stage that we're at now in terms of getting everybody vaccinated as soon as we can. And, you know, Governor, you talked about the kids in school, whether it's personal to us or not. Should be, shouldn't it? All of us, in some way, have a responsibility to make sure that our kids can be in school. We know from the past year, this has not been a good thing. We need to keep them back in school, and we need to protect them. And we do that ourselves by getting vaccinated. The message has been said so many ways. Thank you, Governor, for coming out to say it again for us. I would only add to the students back here. So, you know, sometimes it's not politicians and, you know, even health experts that convince people. It's folks like you. Could each of you be able to talk to a friend or somebody in your circle and convince them that this is the right thing to do? I'm convinced, too, that's the way this is going to happen. We need to help each other. We need to be kind, we need to listen to what people say, but do what we can to certainly encourage them to go ahead and get that vaccine. And finally, a shout out to our future healthcare workers as well as the existing ones. Thank you, thank you, thank you. Your job has been thankless. Maybe we had thought we would be in a different place right now, but nevertheless, you're still there and still delivering the care we need. Thank you so much. Thanks, everybody. And Governor, just keep coming and spreading that message and the resources. You've been a real leader in this country in doing that. Thank you very much. And now I will introduce my colleague in the House who's is certainly carrying the water for the city of Reading over there while I do it in the Senate, Representative Manny Guzman. Manny?
Good morning, everyone. Governor, welcome back to the city of Reading. You know, and Dr. Looney, thank you again for opening the door. RAC has a special place in my heart. Governor, this is where I got my start. I was a graduate from Reading High School and came to Reading Area Community College where I got my credits and transferred over to Kutztown University. So RAC definitely still holds that special place. It's a gem of our community. I actually live 2 blocks down from here, so it's a place that I come to very often to walk by the river. Listen, there's still a lot of vaccine disinformation out there, ladies and gentlemen. Just yesterday, there was a famous hip-hop artist on Twitter who mentioned something about the COVID-19 vaccine and how her cousins told her brother that they got the COVID-19 vaccine and it led to their impotence. This is a famous hip-hop artist on social media spreading disinformation. This is the type of disinformation, Governor, that we have to continue to combat against. Because as I would say to that famous hip hop artist, I would say to any other member of the Reading community, you gotta follow the science. We gotta get off social media and we gotta follow the science. If the scientists are telling us that if you get vaccinated, you have a lesser chance of dying and being hospitalized of COVID-19, how is that a political thing? If the scientists are telling us that wearing a mask decreases your chances of contracting the COVID-19 vaccine and or spreading it to other people, why is that a political thing? I guess it's just the day and age that we live in, Governor. But I know I can tell you one thing. I will continue to do my part working alongside Judy Schwenk and our Berks delegation to continue to let our community know about the factual information that is out there about the COVID-19 vaccine. And specifically, let me give a message to the Latino community here in the city of Reading. Mi gente de la comunidad latina de Reading. Si todavía no se ha vacunado, vacúnese ahora. Vacúnese por usted mismo. Vacúnese por tu familia. Vacúnese por tu comunidad. Todos de nosotros estamos contando con ustedes para que ustedes hagan lo posible y lo correcto. Nosotros sabemos que las vacunas sí trabajan. So, todos nosotros necesitamos hacer nuestra parte para combatir el spread de COVID-19. So just to wrap up that last comment here, what I said to the Latin community here in the city of Reading and to all the Commonwealth of Pennsylvania, to my Latino community, now is the time for us to get vaccinated. If you still have not gotten vaccinated, reach out to my office. You can send us an email, mguzman@pahouse.net, and we'll connect you with George Fernandez and to all the other vaccine providers in our network. Now is the time for you to get vaccinated for yourself, for your family, and for your community. So we're counting on you. I'm counting on you as an elected member and as one of the few Latinos who represent us in Harrisburg for our community to do our part to stop the spread of COVID-19. Thank you very much. Now, let me reintroduce our great governor who's been leading this fight. And Governor, thank you so much for what you've been doing. We're heading back to Harrisburg in a couple weeks, but we'll continue this fight. And I know the governor will be at the forefront leading the way. Governor.
Okay, now we'll be happy to take questions. Yes.
As you mentioned, the state is doing fairly well with adult vaccination rates, one of the highest in the country. But 12 to 18, there's still a lag there. Can you talk about some of what you guys have in place to help increase those numbers for that age group?
Yeah, that's a good point. As of yesterday, the 12 to 18 age group, we were actually 18th in the nation. So we're above average, but it's not 9th or 1st. You know, where we are, we're 1st in terms of the 65 and older. We're 14th in the 18 to 65, but in the 12 to 17, you're absolutely right. We need to do a better job. So I know that's not the age group of you folks out there, but you know, anything we can do, tell your friends, your relatives that this is an age group that is not immune from spreading this disease. So that's a good point. And again, just need to keep spreading the word, keep doing what the Latino Connection's doing to get everybody in every age group the vaccine. Anything else? Any follow-up question?
Yeah, actually, I know that you've been encouraging, there's actually an order in place to have providers work with school districts for school-based vaccine and
Right.
testing. How is that going? I know the school year's kind of young, but how is that going so far?
Well, I think it's going well. Again, the fundamental problem though is not just the vaccine. I mean, the vaccine is our strategy, and I think that's one of the reasons why. Again, now let me just brag a little more. As of yesterday, we were 9th in the country in terms of the new cases on a trailing 14-day average, and I think that's a function of the success we've had with vaccinations. But there's a gap in that strategy, and that is so far. And it doesn't look like this will be ready for another few months. If you're under the age of 12, you can't get the vaccine. You can't get it. And so we are on the horns of a dilemma. We need to have our children back in school, in the classroom. Distance learning does not work. And so we can no longer afford to say we're going to do hybrid or remote learning. This year, we've got to get them back in the classroom, and once they're back, we got to keep them in the classroom. And the only way we can do that, since they can't get the vaccine, is to use the other strategies we know work as second best. Wear the mask, get tested, use social distancing, all the things we learned way back in the early part of the COVID pandemic before we had the vaccine. Now that we have the vaccine, that's our strategy. But again, if you're under the age of 12, you can't access that. So that's why we need to figure out how we keep our classrooms, our kids, our teachers, our educational staff safe in that setting, because we want our kids to stay in the classroom. Yes?
Governor, how do you see the booster shots rolling out? Have you heard when they're coming?
We should know. We don't know exactly, but my sense is within the next couple of weeks, we should know. There's still, I haven't decided, I think in Washington, at what point that should happen, 8 months, 6 months, if at all. Right now, as you know, the boosters are out there for those who are immunocompromised. We have spent a lot of time, the Secretary of Health, Secretary Beam, has done a really phenomenal job of making sure that we have the capacity, whenever that happens, and people start lining up for that booster shot, that we have the capacity to do that. So we have that. As you'll recall, back when vaccines started, Pennsylvania had some issues, and we started with 200 people, institutions who could dispense the vaccine. We're now up to 3,000 in Pennsylvania. So we have the distribution network, we have the access to the vaccines. We figure if everybody right now needs a booster shot gets one, that's about 4.8 million. We have that capacity. We don't have to beg, borrow, or steal. So we're ready whenever the federal government tells us what that, whether it's 6 months, 8 months, and whenever that starts. Anything else? Yes.
I would just ask, you know, a lot of the low rates of vaccinations are among those 12 to 18-year-olds. Do you think that it's a lot of the parents that are, those haven't been out or approved as long, and that's the concern there?
I don't think so. And the reason I say that is because if you look at parents and grandparents, the 65 and older population, we're actually #1 in the country. I think we're tied for first every time I look at it. It's looked at yesterday or this morning. And we're actually above 90, it says in the New York Times, above 99%. Not sure how that can work. But anyway, we're doing very well on first doses. So I don't think it's a problem of people saying you shouldn't get it. I suspect it's more of a convenience thing. And we just need to make it more convenient. I also think there might be a little bit of a complacency that folks, if I'm 17 or if I'm in the 12 to 17 age group, I probably am not as vulnerable. And it's true that you know that age group does not quite get as sick even without the vaccine. But with the vaccine, you're really covering yourself. You can still get pretty sick if you're in that age group. You can still die if you're in that age group. You can still be hospitalized. So the message is, I don't care how old you are, if you can get the vaccine, get it. Anything else? Anybody else have anything you want to add? All right, thank you very much. Thanks, everybody. Oh, sorry. That's the right. Well, what's the question? When is this vaccine going to be available? Yeah. Okay, you're asking someone who's real. I hear the same rumors you do. The federal government right now is saying emergency use authorization might come by October. Now, you're not going to quote me on this, right? This is just hearsay. But if that happens, it's still going to be another 4 to 5 months if the normal process, the FDA process for approval takes place. So it's not going to be until early first quarter 2022 that they can actually get it. Pfizer now is fully authorized. Moderna is still in the emergency use authorization, but neither one is authorized for under 12. So it might be, we might be able to get the emergency use authorization sometime in October, but it's not going to be for a number of months before full authorization comes for that age group. That's what I hear. I'm not a doctor. Well, I am a doctor. I have a PhD, but as my mother always reminded me, I'm not a real doctor. Any other questions? Okay, thank you very much.